I am one of the prevention and crisis recovery coordinators here in Adams 12. We are really looking forward to tonight. We have many of our community partners here with us to talk about understanding youth suicide. Although we may never understand truly why someone chooses to die by suicide, we can try to understand signs to look for, how to support students, and connect them to resources. We recognize that we have a diverse audience here tonight. Some of us come from all different lenses. Some of us here to learn more, others of us who come to support people in crisis, or maybe those of us who have lost a loved one to suicide. We recognize the emotion that this topic may elicit, and we hope through these opportunities tonight, we can learn from one another and take steps needed to support our students, families, and our community. It is my honor to introduce our Superintendent of Schools, Chris Godowski.
Thank you, Sarah, and thank you all for joining us this evening. We're currently in a season that I think is often characterized as one of great joy and celebration. It can also be a time of significant stress, both related to school and work and upcoming holiday celebrations. And what we've learned in recent years, not only in the experience in our community, but in our state and in our nation, is that this can also be a season in which more folks become vulnerable to thoughts of suicide and taking action in that space. And so we're grateful to have you here learning about ways to identify potential risk factors with your child or other loved ones, and how you might intervene and seek out the right support and resources so that this really can remain a season of joy and celebration. I'm really excited to have our partners with us. You see all of them listed at the bottom of the screen. We're grateful that our community sees this as a collective challenge for us to tackle, and that we have so many people willing to partner with us, invest in providing interventions, and share resources and ideas tonight to help our families thrive throughout the season. So with that, I'm going to look back to Sarah, but thank you all so much for being here tonight.
Thank you. So tonight we're going to talk about what we know. We have Lena Heilman from CDPHE to talk about state level data. We want to talk with our local public health folks who are going to talk to us about some of their public health initiatives. And then you'll hear more from me and my partner, Erin Marquez, around our prevention continuum here in Adams 12 and what you can do to support your students. And then we also have a special guest, Brook Griese from Judi's house, talking about supporting after a loss. And then she will have a message of fostering community resilience. We want to take some time to recognize that this is a difficult topic to discuss and may create many emotions when we talk about suicide and grief and loss. And sometimes big emotions come at times that we don't even expect them to be. So at any time you need to step away, please take care of yourself and do so. We are recording this webinar and it will be available on our website in the next coming weeks. However, if you find that you need support right now, please contact Colorado Crisis. And the number here is 1-844-825-8225. The whole number isn't on there, so we will get that number in the chat. I apologize for that. And then you can also send a message to us through the question and answer feature in our Zoom webinar. We are happy to share that information with you and to talk with you. I'm hoping one of my friends is putting the crisis number in the chat for me right now. So without further ado, I'd love to introduce Lena Heilman.
Hi, good evening, everyone. Can you all hear me okay? Good. I dropped the number in the chat. It is 1-844-493-8255. So if at any time today or in the future you feel like reaching out to Colorado Crisis Services, they are an excellent organization. And I think it's always helpful to point out too that you don't have to be the one in crisis to call. If you're concerned about someone else, you have some questions, you don't know if something is something to be concerned about, you are welcome to call Colorado Crisis Services and explain a situation and they can help walk you through some options for you. So my name is Lena Heilman. My pronouns are she, her, hers. I'm the Suicide Prevention Strategies Manager with the Office of Suicide Prevention, and we are located in the Department of Public Health and Environment, or CDPHE. I'm also a sibling suicide loss survivor. That's what drives my work. That's why I'm in this space. And I want to acknowledge that I know many of you have been impacted by suicide as well. And so want to honor the space that brings you here today. Next slide. Great. So I'll be talking about data for most of the 20 minutes where I'll be presenting. But before I go into the data, I wanted to offer some main points, some framing around how we talk about suicide and what we know about suicide. And the first point is on the preventability of suicide. That we know that there are so many things that we can do to make suicide as preventable as possible. And we'll be spending some time today talking about how to make suicide as preventable as possible. The second main point is on stories of hope and resilience. The vast majority of people who feel suicidal will not go on to attempt or die by suicide. And what that means is that in our communities, among our loved ones, in our neighborhoods, in our workplaces, in our schools, there are many people who have survived thoughts of suicide and suicide attempts. There are so many people who have stories of hope and resilience. And part of our work in suicide prevention is learning from people who have survived to know what works for you and what continues to work for you. The third main point is that suicide and suicide prevention are community issues. No one organization or sector can alone be responsible for preventing suicide. That means for young people, we want to work with schools, but it's not just up to schools to prevent suicide. We want to engage families, faith communities, workplaces, youth-serving organizations, and so on. And the fourth point is that prevention, intervention, and post-vention efforts are all important. And I'll talk about that a little bit more as well. But really what that means is that we want to have conversations about suicide early on so people understand what are the warning signs, what are things that make people feel suicidal. We want to know what the intervention supports are. If someone does feel suicidal, where can they go for support? And then after a crisis or after a suicide death has happened, what are the supports in place to help people navigate really complicated emotions? Next slide. All right, so now we'll be moving into the data section of this presentation. Next slide. So before I go into data, I want to again acknowledge that the data we'll be looking at represents our loved ones, our community members here in Colorado. And this is a quotation that I think really goes to the truth of that. And this quotation reads, "Statistics are merely aggregations of numbers with the tears wiped away." So it can be really difficult for me, and I'm sure for many of you, to just look at numbers and to be talking about numbers in big picture form when in those numbers are our loved ones. And that can be, again, kind of a hard balance. I do want to acknowledge that. It can be helpful to look at big numbers because that's where we see where trends are, how many people are dying by suicide, what's causing people to die by suicide. So it's important that we look at the big numbers, and sometimes we have terminology around data that doesn't always feel amazing as people with lived experience. And so I do want to acknowledge that. Next slide. All right, so this is a slide that's talking about suicide in the United States. And the two sides of this slide are really saying pretty much the same thing, which is the majority of people who feel suicidal do not go on to attempt or die by suicide. So in the United States, about 10 million US adults think seriously about killing themselves each year. About 3 million make a plan to die by suicide. About 1.3 million attempt suicide. And in 2020, 44,834 suicide deaths were reported. So this is important for two reasons. One is, if we're just looking at deaths by suicide, we're missing the broad impact of people who are struggling with thoughts of suicide. So we're missing a lot of people's stories if we're just looking at fatalities. And that can be a really sobering, disheartening message. On the other side, you can also see, again, that the majority of people who feel suicidal do not die by suicide. So there's a lot that we can learn from our community members. The other side of this slide shows the same information, just a little bit differently, which is that for every 1 death by suicide, there are 3 hospitalizations related to suicidal despair or attempt, 9 emergency department visits, about 30 non-medically treated suicide attempts, and for every 1 death by suicide, about 230 individuals who think about suicide. Next slide, please. All right, so this is a map of the United States, and we have the states color-coded, and the darker the color of the state, the higher the suicide rate is. And so many of you may have heard that Colorado has a high suicide rate. And that's true. We're usually in about the top 10 states with the highest suicide rates. If you look at this map, what you see is that the states around us also tend to have higher suicide rates. So Wyoming, Utah, New Mexico, Alaska's included, even though it's not right next to us. Alaska has a similar suicide rate to us too. And that's because we share a lot of circumstances that are similar. So firearms are the most commonly used method of suicide, and the states in this Rocky Mountain region tend to have higher firearm or gun ownership. We also know that the majority of people who die by suicide are middle-aged white men. And again, the majority of people in these states tend to have more middle-aged white men than other states. Another component is what we call rugged individualism. Some people have pointed out to our culture in these mountain states is more pull yourself up by your bootstraps. You can help yourself instead of reaching out for help. And so all these factors combined mean that we tend to have some of the higher suicide rates along with other states that are similar to us. Next slide, please. All right, so I have a list here of various data resources. I know some people wonder, where do we get our data from? And I have a long list here of just some of our data resources. The presentation today is focusing on 2 data resources. One is from our interactive public-facing suicide fatality dashboard, which you can find at coosp.org. So all of our data we share with you publicly, and you can sort and filter through if you're curious about what suicide looks like in your county, in your state, in your region. For this presentation, I'll also be looking at the Healthy Kids Colorado survey data. Next slide. Great. All right, so we're going to look a little bit more closely at suicide fatalities in Colorado. And again, before we do so, just to acknowledge again that every number we're looking at represents a life lost to suicide. And that number has had a devastating impact on the loved ones left behind and on their community. So there are people behind these numbers. The other point I want to acknowledge is that Colorado is a quickly growing state. So it's important to consider both the counts, the numbers of people who die by suicide, as well as the rates, how many people per 100,000 die by suicide. So I'll be sharing both of those statistics. Next slide. All right, so in Colorado, as well as across the country, the majority of people who die by suicide are adults 25 to 64. So adults 25 to 64 make up almost 70% of our suicide fatalities. The next largest age bracket or category of people who die by suicide is older adults, 65 and up, who make up about 15% of our state's suicide fatalities. The next largest category is young adults, 19 through 24, who make up about 10% of our suicide fatalities. And then youth ages 0 to 18 make up about 6% of our suicide fatalities. So even though we'll be focusing mostly on youth in this presentation and throughout this evening, it's really important to acknowledge that people of any age can and do die by suicide. And even if we're just focusing on young people, acknowledging the ways that other people in our lives, that their suicide deaths can have on young people. Next slide, please. All right, so it's a little bit of a busy slide, but I know it can be really helpful just to get a sense of what our data looks like to understand better what suicide fatality data is. How do we understand it? So what I have here is a chart of suicide fatality counts, so numbers of people who died by suicide, and crude rates. So in public health, we understand rates as a number per 100,000 people. And this chart is for Colorado residents of all ages. And in the first column we have for each year, 2017, 2018, 2019, 2020, and then our count. So we see that each year in Colorado, about 1,200, 1,300 people die by suicide. That number is staying pretty steady. We see it was a little higher in 2019 than it was in 2020. The next column, we see a crude rate. And we see those 20.9 per 100,000, 22.3 per 100,000. This is the way that we compare rates in public health. What's really important here are our confidence levels. We have a lower confidence level and an upper confidence level. So when we look at our rates and we want to compare rate from year to year, we can't just look at 20.9 and 22.3 and say that the rate went up, because we know that there are a lot of things that go into that data. That means that that rate is not 100%. There are some suicide fatalities that maybe are misclassified in terms of how someone died, or maybe there's some ongoing conversation around residency or how that person will be calculated in data. There's always a little bit of a margin of error. So when we're looking at whether a rate increases or decreases from year to year, we're looking at the confidence levels. And so what we would say from a statistical point of view is that we have seen no statistically significant increase or decrease in suicide fatalities since 2017. So a very complicated picture, but that's really what we're seeing, is that overall in Colorado, among people of all ages, roughly about the same rate of people are dying by suicide from year to year. Next slide, please. All right, so I'm going to focus a little bit more on youth-specific data. Next slide. So a very similar chart, again, where we have the suicide fatality counts and rates per 100,000 for Colorado residents ages 10 to 18. And again, we begin by our years, and then we have our counts. And the counts are usually in the 70s and 80s. And we don't have, of course, full fatality data for 2021 yet, because we're still in 2021. But so far, our 2021 data is very similar to our 2020 data for Colorado at large. We have, again, our crude rate, which is between 11 and 13 per 100,000. And if we look at our confidence levels, again, we would say, based on this wiggle margin of error, that we would say that there's no statistically significant increase or decrease in suicide rates in Colorado for youth. Next slide, please. All right, so focusing in even a little bit more on Boulder, Broomfield, and Adams County, I looked at the data for 2017 through 2020 for suicide fatalities. And our data dashboard breaks up fatalities as 10 to 14-year-olds and 15 to 19-year-olds. And because of data confidentiality, when there are fewer than 3 deaths by suicide, we don't see that data in a public-facing way to maintain people's confidentiality and privacy. So when you see a little star or asterisk, that doesn't mean no suicide fatalities. It means whatever would be reported there is under 3. So for 10 to 14 and 15 through 19, we see the counts, the rates, and the confidence levels. Again, for 10 to 14, we saw 5 deaths by suicide in 2017. We know fewer than 3 deaths by suicide in 2018 and 2019. And in 2020, 6 deaths by suicide. And for 15 to 19-year-olds, we saw in 2017, 9 deaths by suicide, 2018, 12 deaths by suicide, 2019, 12 deaths by suicide, and 2020, 16 deaths by suicide. And again, each of these numbers represents a loved one that has been lost to suicide. And in a really complex picture, when we look at small data in terms of looking at a county and a year, we have really wide confidence levels, because the smaller the number is, I don't know how to make the charts bigger and smaller. You might be able to wiggle that on your own screen too if you hover over and to make the presentation bigger. I saw that in the chat pop up. We have the wide confidence levels, which means that even though the numbers 9 and 12 and 16 indicate growing numbers of people dying by suicide, from a statistical point of view, we would say that, again, there's not a statistically significant increase or decrease in suicide because of that margin of error. Next slide, please. All right, so what are some of the contributing circumstances to why people feel suicidal, attempt suicide, and die by suicide? And in our fatality data, we have data around what are some of the contributing circumstances? What are some of the reasons people have for why someone died by suicide? And so I looked at data for 10 to 19-year-olds, and we see that a diagnosed mental health problem is indicated about 56% of the time, which means that in about 44% of all suicide fatalities for youth in Colorado, ages 10 to 19, there wasn't an underlying mental health condition that was seen as a contributing circumstance to that death. What we see is multiple circumstances coming together. So for about 40% of young people, there was a crisis 2 weeks prior to death. For about a third of young people, there was an intimate partner problem. So either perhaps with a significant other or with another person in a intimate partner situation. In about 7% of suicide fatalities for youth, there was a history of abuse as a child. And about 43%, a family relationship problem was indicated. And about 13%, a suicide death of a family or friend was indicated. And then substance use also shows up. For a substance other than alcohol, about 20%, and alcohol, about 10%. So when we want to prevent suicide, we want to address each of these components, not just one, because we know that each of these components, plus many more that I didn't include, can all work together to contribute to someone feeling suicidal. So our prevention work focuses on all of these pieces. Next slide, please. All right, so I'm not going to go into data too much, just to keep an eye on time. But I want to point out that in our Healthy Kids Colorado survey, we have some really great data around who feels suicidal and what are some of the protective factors people have in place. So we see that females, about 20% of females seriously considered attempting suicide this past year. About 10% of females attempted suicide at least once this past year. And on the other side, in terms of a protective factor, having an adult to go to who is trusting helps reduce suicide. So we saw that females or young women, teens, said that they were the least likely to have a trusted adult in their lives to turn to. Next slide, please. All right, we also look at our data regarding race and ethnicity to see what the impact is of racism and discrimination on young people. And we see that people who experience racism, people who experience forms of violence, people who experience forms of discrimination are at greater risk of feeling suicidal, attempting suicide, and dying by suicide. So again, not going to go into all of the data here, but we do see that Native Hawaiian and other Pacific Islander non-Hispanic youth have some of the highest rates of saying that they have made a suicide attempt this past year, feel sad or hopeless, and some of the lowest rates of saying they have an adult to turn to who is a trusted adult. Next slide, please. We can also look at our data regarding sexual orientation and gender identity. And here we see some really significant numbers in terms of seeing that our LGBTQ+ youth here in Colorado experience greater rates of feeling suicidal, attempting suicide, and dying by suicide. And this is not because there's anything inherent in someone's sexual orientation or gender identity that makes someone more likely to feel suicidal. Rather, it's the systems around them, it's forms of discrimination. So we want to be sure as trusted adults that we are affirming people's sexual orientations and gender identities to help protect against suicide. So being supportive of LGBTQ+ youth is a key suicide prevention strategy. Next slide, please. All right, so we have a variety of protective factors. And again, the two main protective factors are connectedness, feeling connected to people, schools, places, and trusted adults, someone to turn to when we are stressed. Next slide. All right, so we know that there are a lot of things in this life that are challenging. And for some people, feeling isolated, anxious, there's economic stress. There are a lot of things that are making life more difficult, and we always want to acknowledge that. Next slide, please. All right, and then I'm not going to go into suicide attempt data in detail, but it's important just to know that suicide attempt data has different data sets, and it's a pretty complicated picture. And so just because more people are going to an emergency department for suicide attempts doesn't mean more people are attempting suicide. It could mean that more people know where to go when they feel suicidal or have attempted suicide. Next slide, please. All right, so at the Office of Suicide Prevention, we support a comprehensive suicide prevention approach, which means that we want to work all together across all agencies, across communities to do a full-scale suicide prevention approach. So we want to work with mental and behavioral health, with communities, and to coordinate our efforts. Coordination is key. Next slide, please. All right, we also know that the different levels of how we live together impacts our suicide risk. So we want to address the risk and protective factors for people at the individual level, at the relationship level, at the community level, and the societal level. And if people want to know more about that, I'm happy to go into that in the Q&A at the end to talk a little bit more about what that looks like. But I think the upcoming presentations will really showcase this a little bit more. Next slide, please. All right, and again, a comprehensive suicide prevention approach focuses on all these different pieces that come together to support someone. That means connectedness, helping someone feel connected. It means understanding that people having the financial resources to get support is crucial. Educating people around suicide is important. Having the appropriate interventions in place when someone feels suicidal is crucial. Lethal means safety. Helping someone stay safe during a suicidal crisis helps save lives. And then postvention, after a suicidal crisis or suicide loss, we need to support the people that are impacted to make sure that grief and support is part of our community work. Next slide, please. All right, so I'm just going to briefly mention again, next slide. Colorado Crisis Services, again, the number there is 1-844-493-8255. It's not just a phone number. There are many different resources throughout the community that are all linked together in the system. Calling this number or texting will help identify different resources, including like walk-in centers, respite care, mobile crisis teams, and so on. All right, so thank you all so much. I know that was a lot of data in a very short amount of time, so I really appreciate you following along. And again, happy to answer questions at the end. And I want to turn it over now to Allison Long and Meredith Henry and Jesse Reeder. Thank you so much.
Thank you, Lena. We want to acknowledge that learning about suicide can be difficult information to hear. And we want to share with you how local public health works with communities to improve the mental health and well-being of everyone. Next slide. I'm sorry, can we go back one? Thank you. Local public health has a variety of roles for suicide prevention work within communities. Through community engagement, local public health works to improve community connections to support and access to support, including school connectedness and connections to a trusted adult for the youth and adolescent population. Tri-County also works to engage with young people in Adams County to incorporate the youth perspective into suicide prevention, mental health, and substance abuse prevention work. We work to collaborate with the community to ensure that Adams 12 has a knowledge of community resources to address the social, physical, and mental health needs of children and youth. We develop partnerships with communities to plan local action and policies to address issues related to mental health. And we work to promote strategies to optimize mental health and promote emotional well-being by addressing the determinants of mental health, including unemployment, poverty, food insecurity, lack of housing, lack of access to health care, including mental health and substance abuse treatment, and quality to affordable childcare. Through education and awareness, we work on strengthening, Through education and awareness, we work on strengthening skills and knowledge related to promoting help-seeking behavior, building resilience, problem solving, and coping for youth and adolescents through training and social emotional programs. We promote communication campaigns focused on reducing stigma associated with mental health and promoting accessing supports. We work with partners to share community-level data to offer a clear understanding of data, trends, and evidence-based practices. We use data to help communities understand what is happening within their neighborhoods related to suicide prevention, mental health, physical health, and well-being. The use of data has helped us in the development of our new suicide prevention framework for how we work with partners across communities. Next slide. The newly developed suicide prevention framework serves as a vision for suicide prevention work within our communities. It is a visual representation of the complexities of suicide prevention work and shows the roles and responsibilities of local public health working with the community for suicide prevention and overall mental health promotion and wellness. The purpose of this framework is to ensure that everyone involved in mental health and suicide prevention has the opportunity to unite cross-sector collaborations using collective impact, leverage opportunities to create choice for services and resources, educate on risk and protective factors for mental health and suicide, involve people with lived experience to guide service delivery, and to support the continuum of mental health supports and services. The suicide prevention framework is embedded in Tri-County's mental health framework, as suicide is clearly linked to mental health and well-being. With all mental health and prevention strategies, we focus on mitigating risk factors and increasing protective factors. Tri-County Health Department and its valued partner, Adams 12 School District, are working to promote positive mental health, reduction of stigma associated with mental health treatment, and work to prevent substance abuse within the community by strengthening protective factors for youth and adolescents. My colleague Jessie will now talk more about risk and protective factors. Next slide.
Wonderful. Thank you so much, Meredith, for that great introduction. So let's dive a little bit more into what she means about risk and protective factors. So when we're working with so many different community partners who are all doing different work, it's important that we have a shared understanding of the many factors that can influence health outcomes for an individual or a family. Many of these factors are very complex interactions of our own experiences and biology. These experiences may make us more or less likely to engage in a risky behavior, and we call these risk and protective factors. Protective factors are the experiences that we have that may support us to live healthy lives and build resilience to life stressors. In this graphic, examples of protective factors are on the inner circle. Risk factors are the experiences that we have that may lead us to live lives that can have negative outcomes. On this graphic, the risk factors are the experiences around the circle in dark blue. and these can include life and behavioral challenges. When we build protective factors around youth and their families, they're able to build the resilience that they need to face life's challenges and to thrive. For families, protective factors can look like having proper nutrition, getting adequate sleep, and increasing physical activity. It can also look like having supportive conversations about difficult subjects or supporting each other during times of stress. For communities, protective factors may look like increasing connection to school or community programs. In public health prevention, we work to both reduce risk factors and enhance protective factors to support families across all of our programs, including mental health promotion and suicide prevention work. Next slide, please. In the spring and summer of 2020 at Tri-County, we took some time to ask parents and youth in Adams County what they thought about risk and protective factors in their community, specifically around youth substance use, mental health, suicide, violence, and other risky behaviors among young people. And this is what they told us. Young people in Adams County stated that mental health and peer pressure, especially with social media, are among top issues among people their age. When we asked Adams County youth about bullying in their community, we found that they thought that bullying is prevalent, particularly via social media. And they also expressed that the way that bullying shows up looks and feels different than the way that it is traditionally described. For example, not like it is in the movies. Young people share that it is more pervasive and a commonplace experience independent of who young people are or what they look like. Parents of youth in Adams County also noted a concern about social media. English-speaking parents uniquely mentioned a breakdown. Excuse me? Oh.
Keep going.
English-speaking parents uniquely mentioned a breakdown in families, potentially from a divorce or a conflict within a family, was a risk factor. And Spanish-speaking parents noted additional challenges associated with the language gap. While English-speaking parents noted that they didn't see as much bullying with their own kids, several more Spanish-speaking parents said that they had seen it directly with their children or with family members. Now, when we asked about which community strengths and protective factors were important, youth in Adams County specifically mentioned that there is a shared belief that having someone to talk to or a support system, such as a parent, friend, or mentor, is important. They noted that having access to safe spaces, including outdoor spaces and parks, was key. And they said that there is a crucial role for school and family for guidance, attention, and supervision. This assessment is guiding and informing current and future work that TCHD is doing in Adams County to promote the health and well-being of all children, youth, and families. I will now turn it over to my colleague Allison with Broomfield Public Health to share some examples of the work that they are doing in the community.
Thanks, Jessie. So I want to talk a little bit about some examples of what we're doing in Broomfield County. And we have two major initiatives that address mental health and substance use that I want to talk about. But first, I want to mention that in public health, especially when we're talking about prevention work, we often talk about mental health together with substance use. And that's in part because they often go hand in hand, but it's not that people who have mental health challenges don't ever use substances, and plenty of people who use substances don't have mental health challenges, but they are often connected. And we also know that many of the strategies that work to prevent substance use among youth also work to prevent poor mental health and vice versa. So some of the things that we're working on in Broomfield, we have a 5-year behavioral health improvement plan, and we also have a Communities That Care coalition. And both of these are co-led with us by community members. We have parents and mental health providers and educators and nonprofit partners who are working together with us on this work. But the goals of the behavioral health improvement plan are really to reduce stigma that's associated with mental health and to normalize talking about it and to normalize reaching out for help. So we run campaigns and we share stories from our residents about their own personal experiences with mental health and substance use, how they've overcome them, and how they got the help they needed so that others might be encouraged to do the same. We're also looking at ways to improve access to care. We know that many people aren't able to get the treatment for mental health problems that they need because either they can't afford it, they don't have insurance that covers it, or they can't get in with a provider who might have long wait lists. So we're looking at trying to learn more about the barriers in our community, and we're working to identify some potential local solutions to overcoming them. And then finally, with the behavioral health plan, we're also looking for creative ways to increase connectedness in the community and really reduce social isolation. But now I want to talk more about the Communities That Care Coalition. This is what I want to talk most about tonight. It's focused on youth, and it really has the overarching goals of promoting youth mental health and preventing substance use among youth. So on the next slide, I'll share some of the ways that we're doing that. Thank you. You've heard previous speakers already talk about risk and protective factors, so the things that we can focus on to prevent suicide and other negative health outcomes. In Broomfield, our Communities That Care Coalition helped us look at local data, and we held community conversations so that we could determine what risk and protective factors we could focus on now. And what we determined was that we really need to, one of the things we need to look at is figuring out how we can increase the number of youth who participate in after school activities that are either at school or in the community. And these are things like sports and arts and volunteering or other types of pro-social ways of getting together. And this is important because we know that youth who participate in these kinds of activities are less likely to engage in risky behaviors and less likely to experience poor mental health. So we really want to understand what some of those barriers are and why more youth may not be involved, so we can improve this protective factor in our community. And at the same time, we looked at risk factors, and a couple that stood out for us are the number of youth who have favorable attitudes towards substances, or another way of saying that is the number of youth who may not fully understand the harms of using substances like alcohol, marijuana, vaping. And then secondly, again, you've heard before Adams County, but Boulder County we heard as well, Broomfield County as well, that our community expressed concern about bullying and the impact that it has on youth mental health and substance use. And so we're looking at how can we reduce these risk factors in our community while increasing the protective factors. And on the next slide, I'm going to show you a few of the ways that we're addressing these. And so the first is supporting our schools in advocating for social emotional learning. And we're also looking at how we can do that in the community. So you may have heard your student talk about classes like life skills or second step or path, or they may call it something different in every school, but these are sessions that are age appropriate. They start in elementary school, they go through middle and high school, and they're designed to help students develop self-awareness, self-management, relationship skills, and responsible decision-making. And the reason these are so important is because students who build these skills are more likely to be resilient when they're faced with really any life challenge. We know that Adams 12 now has professionals dedicated to social emotional learning in almost all of their schools. And we in the community are also working on ways that we can build these skills. For one example is we hosted a Sources of Strength internship last summer, and that's really all based on social emotional learning. And promoting positive youth development is the other strategy. This is basically trainings for adults who work with youth or who interact with youth regularly. It could be parents, coaches, teachers, others. And the goal is to help those adults engage with youth in a strength-based way so that we can then really help them develop their full potential. And a perfect example of this is if you think about your favorite coach or your favorite teacher, you're probably not going to mention the teacher who maybe had the most knowledge of math or the coach who was the best skilled soccer player you've ever seen. You're more likely to identify the adult who was really able to see you or to connect with you, or who was able to give you the confidence to want to do better. And so that's really what PYD, positive youth development, conveys. It conveys ways that we can really see youth for who they are, the strengths that they have, so that we can build their confidence and motivation in order to help them accomplish whatever they're setting out to do. We've had really great success in Broomfield in training our rec center staff, our library staff. Many nonprofit partners have stepped up to be trained, and we're continuing to offer these trainings as much as we can. And the final strategy that we're working on is to, I mentioned this previously, but really to understand and reduce barriers that many students face in participating in school or community extracurricular activities. And some of those obvious barriers are things like the cost. How expensive is it? Is it hard to get to? Is transportation a barrier? Or, many students might just feel overwhelmed by school in general, and they just can't give up the time to engage in an after-school activity. So we're trying to understand more of what those barriers are. We hosted a summer internship this year where youth identified some additional barriers that we may not have thought of. They also shared suggestions for ways that we can support them in feeling more connected in the community and more safe in the community. And we're going to be working on these over this next year with their help. So on the next slide, I mentioned youth. I really want to talk a little bit more about the role of youth in all of this, because we can have the best intentions in the world, and we in public health can be up on all the research and best practices, but if our youth aren't involved, providing us with input and guidance, we could be way off about what resonates with them in our communities. So we established an advisory group of youth in Broomfield that's called Broomfield Youth for Youth, or Y for Y. And they are a group of local middle and high school students that advise our Communities That Care Coalition. And they also have goals of their own that they've set. They are working on preventing substance use among youth. They're working on improving overall well-being among their peers. And they're also working to help their peers form positive relationships. So you can follow them on their Instagram page that's listed here on the slide, or on Facebook. You can email them for more information if you're curious about what they're up to, with the email on the slide. And they also have a podcast called Sincerely Teens that you can search for wherever you listen to podcasts. And so the next slide, an important role of public health is really to provide education to our community members on various health topics, and also to share resources. And so both Broomfield and Tri-County health departments are promoting this campaign called Below the Surface. And Below the Surface was created by youth, for youth, as a way to support young people who feel pressured to appear as if everything is fine. But just below the surface, they struggle with feelings of isolation, stress, anxiety, depression, things related to their studies or relationships or drugs and alcohol. And the messaging in this campaign really tries to reassure them that it's okay to ask for help. No one dealing with a mental health or substance use challenge is alone. And regardless of how big or small the challenge is, there's a trustworthy place where they can turn to for help. And so all they need to do is text TALK, T-A-L-K, to 38255, and they can get connected to a trained counselor from the Colorado Crisis Services Program that Lena mentioned previously. It's free, it's confidential, and it's run by the Colorado Department of Human Services. And so I really recommend that you and or your teen put this number in your contacts, so that you have it if it's ever needed. It's not something that you'd want to be searching for if you're in crisis, or if someone you know really needs it. And then on the final slide, I also want to mention that we're promoting the new I Matter program. And this is a new program in Colorado where every youth is eligible for free therapy sessions. And the way to access it is by going to imattercolorado.org. And it can be either a parent or youth themselves. And you would begin by taking a confidential online survey about their mental health. And then you can schedule sessions with a licensed behavioral health clinician. And it's primarily telehealth, so it's primarily virtual. Like I said, it's a new program, and all Colorado youth under the age of 18 are eligible to receive these free services. And if you're receiving special education services and under 21, you're eligible as well. So imattercolorado.org for the 3 free therapy sessions. And now I want to turn it back over to our Adams 12 hosts. Thank you.
Thank you so much. It's so great to hear from our state level and local public health departments. What really resonates with me is how you all are talking about one of our #1 protective factors and is having a trusted adult. And one of our district's major improvement strategies is to create inclusive environments and really nurture those student to staff or student to trusted adult relationships. And so as I get into talking about what we're doing at Adams 12, it's great to see the synchronicity between all of our groups working together. So thank you to all of you. And we should have time at the end to ask questions directly to our partners. So I want to talk a little bit about Adams 12. In Adams 12, we have a 3-pronged approach to suicide. We like to talk about awareness, assessment, and action. So in suicide awareness, we have staff training every year on signs of suicide and what to look for. We teach our staff, what do they need to look for in students, how to support students, who are the people in the building that can access really good supports and help students in crisis. We have a curriculum that we use in middle school and high school called Signs of Suicide, and it teaches the kids an acronym of acknowledge, care, tell, so ACT. And it teaches the students what are the signs to be looking for in a friend, how do you acknowledge that they are in pain and struggling, and how do they tell a trusted adult to support and get them to help. We also have sources of strength, which our public health partners did talk about. And sources of strength is a hope strength model that teaches peers how to teach peers their sources of strength. So sources of strength might be positive mental health, physical health, access to physical health, having positive friends, family support, all of those things that are those protective factors that help us when we're struggling. And then we also have what's called QPR, which is a training for non-mental health professionals to identify signs of suicide and to get help. And we offer those sessions in both English and Spanish throughout the whole school year. And so we will be sharing that information as well, but it's always in our newsletter as we put those out every month. As far as assessment, we have trained professionals in the schools, our school psychologists, school counselors, school social workers who work together in the schools to assess a student anytime they are having thoughts of suicide, either through verbal discussions, or maybe we see something in a writing, or a teacher is concerned, or you as a parent are concerned. You can call the mental health provider at your school, and we will assess your student and involve you in that process and support the student to access more help if needed. We create recovery plans which talk about why students are having these suicidal ideations or suicidal thoughts, and what we can do to help them through the crisis and help them get the supports that they need. And we always like to say is a snapshot in time, that sometimes we how a student is feeling in that moment is how they're feeling in that moment. And we know that suicidal ideation can ebb and flow, and so it's important that we connect students to the help when they need it. And then action, we collaborate with parents and guardians and school professionals, and also outside therapists or hospitals, as if children have to be hospitalized. And after they return from hospitalization, we provide plans, we work with schools around their teachers and supporting the schoolwork that they've missed and how to reduce the anxiety there, and really have that continuity of care around all the different people that are supporting the student as they return back to school. And so one of the things that we always like to talk about is that suicidal ideation is often a maladaptive coping strategy. When we think about students having thoughts of suicide or wanting to die, it's not often that they actually want to die, but they want the pain to stop. And they're using a really maladaptive or bad strategy to get their needs met. So if you think about it, we all have maladaptive strategies that we've used throughout our lives. Maybe we're stressed and we go home and we eat a whole bag of chips, or we're stressed and we know that there are healthier strategies that if I just went on the exercise bike or went for a run, I would feel a lot better than eating the bag of chips so that I feel sick later. Well, this is very similar in that kids have oftentimes these three big emotions: anxiety, depression, sadness. And when we have these big emotions, we have to teach kids what to do with those emotions. And oftentimes it's a reaction, or the ideation is what they feel like is the only way to cope or survive. And so what we often teach are other ways to cope and deal with those stressors. And when I think about our kids, they have all these mixed emotions. And when we have kids cycle through our emotions, we don't worry as much. But when they stay in one emotion, either on the peaks or the valleys, is when we really need to be concerned and get them the support that they need. Anytime we talk about suicide, and Allison mentioned this as well, that we always want to have student voice at the table. Students often can tell us what they need better than we can tell them what they need. And so this video that we're about to share is talking about how our teens want us to show up for them and to talk with them, and to not be afraid of asking hard questions or leaning into their discomfort or their big emotions. So this video may be hard to watch and might bring up more emotion for you. So feel free to, step away, to take a minute if you need to. But this video is really direct, take the time that you need to. What I want to say too is that this is directed at parents. However, if you are a teacher or a staff person or a provider at a school, these strategies can also be helpful for you.
I have my ups and downs, just like anybody else.
Maybe more than anybody else.
I can be hard to figure out.
And I like my privacy. I don't want you looking over my shoulder all the time.
But you know your kid better than anybody else. And if you think he's acting different than usual...
Acting really down, crying all the time for no good reason.
Or getting really mad, not able to sleep, or sleeping too much.
Shutting her friends out or giving her stuff away.
Acting reckless, drinking, using drugs, staying out late.
Suddenly not doing stuff he used to love.
Or doing stuff that's just not like him.
It might be nothing to worry about. It might just be high school.
Or it might be something more. He might be depressed.
Not just feeling down, really depressed.
It might be that your kid is thinking about killing himself. It happens. More than you think. More than it should.
And people say, I had no idea.
I thought it was just a phase he was going through.
I never thought she'd do it.
I wish he'd come to me.
I wish he'd said something.
I wish I'd said something.
When it's too late. So if you think your kid's acting different, if she seems like a different person, say something.
Say, what's wrong? How can I help?
And ask straight out. Are you thinking about killing yourself? It doesn't hurt to ask. In fact, it helps.
When people are thinking about killing themselves, they want somebody to ask. They want somebody to care.
Maybe you're afraid you'll make it worse if you ask. Like, you'll put the idea in their head.
Believe me, it doesn't work that way.
It doesn't hurt to ask.
In fact, the best way to keep a teenager from killing herself is to ask, are you thinking about killing yourself?
And what if they say yes?
Or Maybe.
Or sometimes?
Well, here's what you don't say.
That's crazy.
Don't be such a drama queen.
You're making too much of this.
That boy's not worth killing yourself over. That's not going to solve anything.
You're just trying to get attention.
You're not going to kill yourself.
What you do say is,
I'm sorry you're feeling so bad.
How can I help? We'll get through this together.
let's keep you safe.
A lot of people think about killing themselves, adults and kids.
Most of them never try it, but some of them do. So if your kid says,
I'd be better off dead.
I can't live with this.
I'm gonna kill myself,
Take her seriously. Find someone she can talk to about it, someone who knows how to help.
Sometimes kids want to kill themselves because something happened. A breakup, a failure.
But sometimes it goes deeper, and it's not going to go away by itself. Get some help. Talk to your doctor.
Or a counselor at school.
or your minister, but don't just let it drop.
And make sure that your kid always has someone to turn to. Someone he trusts. Make a list together right then. 3, 4, 5 names.
Put a suicide hotline number on there too. Have him keep that list in his wallet so he always knows where to turn.
Make sure your home is safe.
If you have pills she could use to hurt herself, lock them up.
If you have a gun, don't just lock it up. Get it out of the house. The bullets, too.
And one more thing. If you think your kid might be about to hurt himself, don't leave him alone.
Take him to the emergency room.
Call 911 if you have to. We all have our ups and downs, but sometimes it's more than that.
If you think something's wrong, the only way to find out is to ask.
Ask straight out. Are you thinking about killing yourself?
Don't wait until you're sure. Trust your gut.
Because it never hurts to ask.
And it can make a big difference.
All the difference.
in your kid's life.
I want to take some time to further stamp the messaging in the video we just viewed. Youth development is often characterized by heightened states of emotion. As their brain develops, they navigate life experiences, they work to increase their autonomy and independence, and to figure out ways that they can develop their individualism and their identity. So how do we know when it's more than what is normal or typical for youth development? First, I want to echo that you know your child best. If you're concerned or something doesn't feel right, check in with them. Express your concern for their well-being. As you heard from the previous presenters, there are risk factors that can increase a person's level of risk for suicide. Much like one's physical health, there are predispositions, whether it could be heart disease or diabetes. The same stands true for risk factors for suicidality. Those risk factors can look very different. It could be misuse or abuse of substances or drugs, mental health disorders, social isolation, lack of access to behavioral health care. In addition, there are warning signs or clues that can indicate that a person may be at immediate risk for suicide. This could be or look like expressing feelings of hopelessness about the future or talking about wanting to die, withdrawing from friends, an increase in anger or hostility, sleeping disturbances, or experiencing stressful situations involving loss and change. The more clues that an individual is exhibiting, the greater level of risk they may be at. If you're concerned, the best way to help is to reach out and connect that person to support. Next slide. What we also heard from the youth in the video is if you're concerned that a person may be having thoughts of suicide, ask them, be direct and ask them, are you thinking about killing yourself? There's a common misunderstanding or myth that talking about suicide directly will put the idea in someone's head, when in fact the opposite is true. When we ask someone if they're having thoughts of killing themselves or thoughts of suicide, it often decreases anxiety and opens up that line of communication. Those who are at the greatest risk for suicide often feel isolated or that they're a sense of burden to others. So when we're willing to open that communication, to show care and concern, show them we're not afraid to have that conversation and lean in, that can really open up that opportunity for them to talk and help them understand that they're not alone. Next slide. I want to highlight one of the most common responses that we often hear regarding the person who may be expressing suicidal ideation or who does express suicidal ideation. And it's that they're often trying to get attention or try to gain attention. And when we view the behavior through the lens of attention seeking, we often see that behavior in a negative light, right? We see it as something that they're trying to get that attention for, and so that we shouldn't give them that attention. So maybe we need to ignore it so that we don't reinforce it. And for a person who may be having thoughts of suicide, this can further reinforce their belief that they are isolated, that people don't understand them, and that they are a burden. So when we reframe this behavior as connection seeking, it allows us to analyze the behavior from a more positive perspective and see it as a means of communication and expression to meet them where they're at and to help them know that we understand them, that we're there to validate them, and we want to help keep them safe. As you heard in the video, the youth identified supportive ways to respond when a person may be experiencing a crisis, such as, that sounds really hard, and it sounds like you've been really going through a lot, or you really are hurting. Thank you for trusting me enough to share how you're feeling, or I can see that this has really been hard for you. Often when someone shares that they're emotionally hurting or experiencing a problem, we as humans want to move to the state of action, right? They came to us with that problem. Clearly they're wanting our help. And so we often feel that it's our duty to fix it, to fix that problem, or to cheer them up, or to make them feel better, especially as adults with youth. In our attempt to make them feel better, we can be perceived, and like I said, with youth in particular, as these advice monsters, right? These people who just are talking at us and telling us what we need to do, and may make them feel like we don't understand where they're coming from, or we don't really get it, which is unintentional oftentimes, but can really make them feel like it's minimizing. It makes the person feel like, oh, you really don't understand where I'm coming from, or, oh, here we go again, you're just going to tell me how it is, which can shut down that communication. So in a moment, we're going to show you a video clip from the movie Inside Out, which can really highlights two different ways of entering into a space of somebody who's experiencing big emotions. And it's the space we call minimizing and maximizing. So in this video, you'll see an example of a character expressing feelings of sadness as a result of a loss of something they loved. And I just want to draw your attention to the two different ways in which the characters Joy and Sadness respond to the character Bing Bong when he's sad. And then we're going to come back to what that can look like, the minimizing and maximizing of those feelings.
No, you can't take my rocket to the top. Riley and I are going to the moon. Riley can't be done with me.
Hey, it's gonna be okay. We can fix this. We just need to get back to headquarters. Which way to the train station?
I had a whole trip planned for us.
Hey, who's ticklish, huh? Here comes the tickle monster. Hey, Bing Bong, look at this. Oh, here's a fun game. You point to the train station and we all go there. Won't that be fun? Come on, let's go to the train station.
I'm sorry they took your rocket. They took something that you loved. It's gone. Forever.
Sadness. Don't make him feel worse.
Sorry.
It's all I had left of Riley.
I bet you and Riley had great adventures.
Oh, they were wonderful. Once we flew back in time. We had breakfast twice that day.
Sadness.
It sounds amazing. I bet Riley liked it.
Oh, she did. We were best friends.
Yeah, it's sad.
I'm okay now. Come on. The train station is this way.
As you can see, Joy attempts to distract Bing Bong, right? Oh, we can fix this. Come on. She tries to be silly, telling him he's going to be okay, trying to redirect his attention. And this just doesn't seem to be helpful, as Bing Bong is unresponsive to her strategies. He's continuing to experience that big emotion. And although it was well intended, Joy unintentionally is minimizing his feelings. She's not giving him the space to express how he feels and where he's coming from. Sadness, on the other hand, leans into that discomfort. She sits down next to him. She validates how he's feeling. She shares, like, they took something that you loved. She agrees with his feelings. Yes, that this would be sad. She encourages him to go deeper. I bet you and Riley really had great adventures, and allowed him to share his experience. Many of us know that sitting with youth in crisis can be messy and doesn't always wrap up as nicely as it did with sadness and Bing Bong. Yet, oftentimes, when we're willing to hold space for a person who's experiencing those difficult emotions, and those intense emotions, and sit with them in that pain and validate how they're feeling during that time of crisis, it can often help them move through those feelings in that moment, so that they are in a state of accepting that help and support. And that help and support can look very different. It could be developing a support plan with the youth within your home, connecting to somebody in school around how they can get support, or connecting to outside resources. But as we know, when we enter into a space where we are entering with the intent to understand how someone's feeling, to validate that it must be hard, and let them know that we care and offer hope, we can often get them to that support and through that difficult time. You also heard the youth in the video talk about restricting a person's access to lethal means. The impulse to end one's life and the readiness to act on those thoughts are often short-lived and are not stagnant. We also know that suicidal crises can reemerge at any time and can be activated by a host of factors or life stressors. It can be difficult to predict when a person has moved from a state of acting on their ideation, and these situations can escalate very quickly. So one way we can reduce risk is to restrict access to lethal means, whether it's guns or pills, before a suicidal crisis occurs. So when we take away that means in which a person has identified, or remove means with high lethality, we can keep those that we love and care about safe. And sometimes emotions can become bigger than one individual or family can support independently. There may be times when you need immediate support from someone and that you're concerned about. And so as we've talked about, there's Colorado Crisis Services where you can call either if you're concerned about your child and want to get some more information, or you can call alongside your youth. To connect to somebody who can help support you through that crisis or connect you to resources, or you can go to your nearest emergency room who can also connect you or direct you to a walk-in clinic. And if you're concerned about your child's friend, or maybe you have your child has a peer that they're concerned about, then you would want to call Safe to Tell. You can make an anonymous tip through Safe to Tell, and they will provide immediate assistance to that person that you're concerned about. In addition, we have trained professionals in all of our schools, whether they're counselors, mental health providers, or social emotional learning specialists, as well as really all of our staff who are trained to recognize the risk factors and warning signs and support youth and families. In particular, our mental health providers, counselors, and social emotional learning specialists can really partner with families to help identify and address needs and connect families to the resources that we have within our community. We also have many community partnerships that we help facilitate referrals to, such as Second Wind, who offers 12 free sessions to students who may be experiencing suicidal ideation or have expressed that, as well as other community agencies such as Community Reach, who can also help with addressing behavioral health concerns. Well, we'll be sending a follow-up email that has a link to our website here in Adams 12 that can also direct you to the websites and those resources. Now I'm going to hand it over to Dr. Brook Griese, the co-founder of Judi's House. Thank you.
Thank you, Erin and Sarah for hosting, and for Adams 12 for making this evening possible, and to all of you for hanging in there. I know we're at 7:16, so I will try to talk quickly, although I do not want to rush through this because I know that many of you in this Zoom room together are grieving tremendous losses, and I want to talk with you today about Judi's House so that you're aware of it. I'm going to talk a little bit about grief experiences after a suicide death and how to support grieving youth, and by sharing some hopeful reflections with all of you on resilience. So for those of you who are not familiar with Judi's House, that's a picture of our house there. We're a comprehensive grief center for grieving children and families. So we're currently located in this 1800s house near City Park. But we're moving next year actually to a more accessible and purpose-built home in Arroyo near Central Park. We pride ourselves on having a very easy door to walk through, that it feels like kids and families are coming to a friend's house to visit, and all of our services are free, which makes it even more accessible. Next slide, please. So my husband, Brian, the cute little guy in the picture there, and I founded Judi's House in 2002 in memory of his mom, Judi, who died of breast cancer when he was 12. And at that time, he felt like he was the only 12-year-old boy who had lost his mother, and felt incredibly alone, different, sad, and very, very angry, and at risk of heading down a dangerous path if he hadn't found a protective factor. We've heard a lot about risk and protective factors in sports. It was an outlet for him. And when he found himself with a platform in the NFL, some of you might remember him as a quarterback many, many years ago. Many of you will not remember. He did play for the Broncos, but he wanted to help other kids like him have a place to go where they could feel less alone and connect with other kids who had a similar loss. We provide free services in English and in Spanish to children ages 3 to 25 and their caregivers. We do a thorough assessment, we provide group counseling, and we have individual family and couples counseling, both at Judi's House and in schools throughout the Denver metro area. Since our founding, we've served over 12,000 and reached many more through our research and training initiatives of JAG Institute. We are incredibly grateful for our partnership with Adams 12. It's a longstanding partnership with the school district and with schools and community organizations throughout Denver. Our community-based care team, led by Katie Wilberding Cross, partners with schools to provide assessments and grief groups and training and education in the schools. And our school-based Pathfinders groups, which are a 10-week group, are provided primarily in middle schools, where our grief counselors from Judi's House meet with kids during the school day, which allows us to reach many kids who would not otherwise be able to make it to Judi's House for our whole family programs, although many do then bring their whole family to our programs, which we are so grateful for, because kids and families report feeling more equipped to cope with their grief after participating in our groups, and a deeper sense of connection with those who've experienced a death loss. Because, next slide, please. While many youth who are grieving do feel alone and isolated and different, unfortunately, they are not alone. 1 in 14 children in the US will experience the death of a parent or a sibling before the age of 18. And this more than doubles when you look up to age 25. And the actual number of bereaved youth is much higher, since this doesn't capture extended family members and friends. And because of the time lapse in CDC data, this also doesn't capture the tremendous amount of death losses that we've had to COVID and during the pandemic for people who were not able to access care for other reasons as well. Deaths in the US rose by 18% in 2020, leaving many more children and families grieving. Next slide, please. We know we've talked a lot about risk and protective factors tonight, and with grief, we know that kids are at risk of greater disruption to their mental health, their relationships, their academics, self-esteem, because there's so many factors that play into having a death loss. But we also thankfully know that there are protective factors that can bolster these kids and these families. The caring community that surrounds them, the positive role models at schools, the healthy coping skills that they can learn in their groups, the peer support and relationships with those caring adults that we heard about, that is key to keeping them on track developmentally. Next slide. Because grief is complex. We wish that it was as linear and predictable as the now outdated stages of grief led us to believe. but it's much more complicated than that. There are no timelines for grief, and it is complicated by so many factors: the relationship to the deceased, whether it was close or distant, the cause of death. Next slide, please. And suicide deaths in particular, we know, are complex for many, many people. And it's important to remember that no suicide death is the same. So someone who is grieving a suicide death can be experiencing both, and that it was experienced as sudden or anticipated, maybe because there had been so many mental health or other concerning issues before the death. It can feel very impulsive, especially if it was by a child or a teen. Some suicides feel violent, others feel more peaceful. For those who are grieving, sometimes it's clearly an intentional suicide, and sometimes it's ambiguous, leaving these questions of why and the what ifs. For some, it can feel like a relief given the amount of suffering the person was in, even though it is still a very devastating death. And some of our suicide deaths are kept secret, while others are made very public, especially by social media and today's technology. And all of these factors can be complicated in deaths by suicide by religious, cultural, and societal beliefs and attitudes that, again, often lead to families and children in particular who are grieving a suicide death feeling stigmatized by their loss. Next slide, please. But there are so many things that we can do and that each of you can do to help those who are grieving, and kids in particular. I think you've heard a lot about this. I think the art of listening and that attentive listening is so helpful for us to always remember. Make time, be fully present, no distractions, put that phone away, put all devices away, put work away, open up conversations, talk about the person who died. Don't shy away from talking about death and the person who died. Ask questions without jumping to solutions, and really listen to your kids and their answers. Reflect back what you heard to make sure that you have gained a true understanding, and answer their questions honestly. I think this is very important. People often don't know whether they should share that it was a suicide death. It is, if it has been shared by the family and by the school that it is a suicide death, it's important that kids hear from their trusted adults that it was suicide, because otherwise they will not know who to trust in these moments. That's part of creating safety. That's part of really wrapping around kids, and make sure you're wrapped around with support from friends, family, schools, other professionals, so that you can really truly be there for kids and for each other as a family. Show genuine empathy. And the last one that you can't see, I just noticed it got knocked off on the slide, but it's the most important one, is to foster real connection, to really make sure that kids feel that sense of connection. Next slide, please. When we were planning this presentation back in March of 2020, right before the pandemic put us all in our homes, I was reflecting on what made me hopeful, and what I was worried about at that time was not the pandemic that was going to lead us to being in our homes and away from supports and that sense of connection that is so key to us. We thought we'd be back doing this presentation a few weeks later, and here we are almost a few years later. But what was helpful and important at that time is the same, which is connection. And I was thinking a lot at that point about technology and social media getting in the way, and we have to keep watching that. But we mostly need to make sure that we're having that eye-to-eye, face-to-face connection. I know that today is a great example. We aren't able to be in person, but use the time with your family, use the time with the kids that you are in relationship with in your classrooms or in whatever activities you are involved with youth, to make sure they feel connected. We give all of our kids these "We Are All Connected" bracelets when they come to Judi's house, so that they know that they are not alone and that they are a part of a larger community that cares for them. And that's so key to their hope, their healing, and their resilience. And then next slide, please. I also had it in my mind way back then, and still today, this idea of kintsugi. And for those of you who are not familiar with kintsugi, it's a longstanding Japanese practice of repairing broken pottery or ceramics with gold. So rather than doing what we tend to do of when we feel broken, when we've broken something, repairing it, camouflaging it so that we don't see those cracks. Instead, kintsugi celebrates those imperfections and those places where we have come together and healed, and really reminds us we're stronger where we have healed. Next slide, please. So as I was reflecting on the last 21 months, this quote is one that has always been really important to me. I've had it hanging in my office for as long as I can remember, that perhaps strength doesn't reside in having never been broken, but in the courage required to grow strong in the broken places. And I think of our whole world has really experienced feeling broken. And I hope that in our communities and the amount of losses that we've experienced of all types, I hope that as we think about this time in our history and as we move forward, that we think about it not as being broken apart or broken down, but as being broken open to allow the light to come in, to help us understand and to see things more clearly. And what I am most hopeful right now, and this evening is a perfect example of shining a light on things that we need to talk about as a community and really acknowledging the amount of pain that there is and the power in healing and the ways that we can grow stronger together as individuals, as families, as schools, as communities, and as a planet. So this is the hope that I have for all of you. I am so grateful to be with all of you tonight and that you've hung in during this stressful time of year. Thank you to Adams 12 and our partners. And I wish you all a holiday season that's full of love, peace, and as our superintendent said, joy. And that was as fast as I could talk. We have 2 minutes left.
You are absolutely great. I'm going to invite our speakers back and just open this time. We know it's late. We know some of you maybe have been eating dinner alongside us, but we want to open up for questions just the last few minutes. So if there's any questions in the chat or Q&A, we can answer those. We had some friends fielding those questions, so I'm going to look to them.
Yeah, I was going to say we had a couple of questions in the Q&A and Lena went in and did a great job addressing those concerns. And I believe everybody can see her response to those questions.
Okay.
And I have not seen anything else in chat this evening.
All right. Well, we just really want to thank all of you. Thank you, Lena and Meredith and Allison and Jesse and Brooke. And of course, my wonderful partner in this work in Adams 12, Erin Marquez, for such a lovely presentation, and Katrina Fernandez. Oh,
we got a really good question in the chat that just popped in and I don't want us to miss it.
Okay.
Not that I need to be thanked.
We really appreciate it. But yes, we'll answer the next question. What I want to say too is if you want to go and be with your families this evening, please feel free. We will have this uploaded on our website. If you want to stay for a few more minutes, we will field some questions.
What resources does Adams 12 have or our surrounding community for students who have lost friends to suicide?
Such a great question. So we certainly work with students who have had a loss to suicide. We have school counselors that connect with students every day and can certainly be that first point of contact, or our school social workers, our social emotional learning specialists, or school psychologists. Like Brooke shared, we have a connection with Judi's house. And so we often use them as a really wonderful resource. Katie Wilderbring Cross has come in and done classes actually in our schools and talked with kids about grief and loss. We have school-based therapists in many of our schools who can connect and meet with students. And so I think the best place to start is with that point person at the school, and then we can kind of target what your student might need.
All right, thanks, Sarah. And Lena did also put in just a quick link resource as well in response to that question for everyone. I think that is it.
Okay, well, thank you all. Thank you for coming. We appreciate you. We appreciate you learning alongside us. Please reach out with any questions. We will have a follow-up email with some resources, and if you need to connect with us, please let us know that, and we will respond to you as soon as possible. judyshouse.org has some wonderful resources on their website in both English and Spanish. So feel free to peruse and look through that. But thank you, and have a wonderful night, and we will see you soon.